Okay, now we are going to visualize the mechanism of labor. Still on the fetal parameters on the passenger. Now, in the mechanism of labor, you need to know that there are different mechanisms of labor. The first mechanism of labor is the fetal descent. Is it clear? The second mechanism of labor is the engagement. Is it clear? The third mechanism of labor is after engagement you have flexion. Is it clear? So you have descent, even flexion. No, engagement and you have flexion first. Is it clear? And then you have engagement. Is it clear? So that's the third mechanism of labor. The fourth mechanism of labor, after engagement now, the child needs to rotate and it's going to internally rotate first. Is it clear? Now, after internal and internal rotation, the child is going to extend the head. You have extension. Is it clear? After extension, the child now is going to externally rotate. Is it clear? After external rotation, the child is going to restitution. He is going to take back his initial position. After restitution, you have delivery of the anterior shoulder, and the anterior shoulder, it is the shoulder which is closest. Anterior shoulder is the shoulder which is closest to the maternal pubic symphysis. And then the next one, we have delivery of the posterior shoulder. Is it clear? And then the last one now is 10. Number 10 now is going to be the expulsion of the fetus. Is it clear? So those are the different elements when you are going to evaluate the mechanism of labor. Now, here is already at the level of the management. When you want to visualize the mechanism of labor is when you're already managing a patient in labor, in the second stage of labor. Is it clear? When you want to manage a patient in the second stage of labor. Is it clear? Now, before speaking of second stage of labor, I need to tell you that the different stages of labor. You need to know the different stages of labor. So you need to know that labor has 4 stages. Labor has 4 stages. Is it clear? You have stage 1, you have stage 2, is it clear? You have stage 3, and then you have stage 4. Is it clear? Now, stage 1 is divided into 2 phases. It's divided into the latent phase, and it's divided into the active phase. Is it clear? Those are the 2 phases of labor. Is it clear? The latent phase and the active phase. Now, for the latent phase is going to, and the active phase depend on if the patient is nulliparous or multiparous. Is it clear? So I'll put N for nulliparous and M for multiparous. It's going to depend on both of them. Now, in nulliparous patients, the latent phase is going to vary from 16 hours to 20 hours in nulliparous. So in nulliparous patients, the latent phase is going to vary from 16 hours to 20 hours with an average of 18 hours. Is it clear? And now, in multiparous, the latent phase is going to vary from 12 hours to 16 hours with an average of 14 hours. Is it clear? Now, that is for the latent phase. Now, the active phase of labor. The active phase of labor is going to vary now with respect to the rate of cervical dilatation. So there is no timing for active phase, but instead there is a rate of cervical dilatation that you have to consider for nulliparous and multiparous. Is it clear? Now, for nulliparous, the rate of cervical dilatation is usually 0.8 centimeter per hour to 1.2 centimeter per hour. So that's the rate of cervical dilatation in multiparous, and an average rate of 1.0 centimeter per hour. Meaning that no, sorry, this is for nulliparous. For nulliparous, is going to be 0.8 to 1.2 centimeter per hour, with an average of 1 centimeter per hour is equal in nulliparos. But in multipowers, the rate is going to be between 1.2 centimeter per hour to 2 centimeter per hour, with an average of 1.5 centimeter per hour in multipowers. Is it clear? So if you have a rate of cervical dilatation between 0.8 to 1.2 centimeters, is it clear, with an average rate of 1 centimeter per hour, is going to be for nulliparos. For multipowers is 1.2 centimeter per hour to 2 centimeter per hour, with an average rate of 1 centimeter per hour. So that is for the different timing. Now the next thing that you have to note now is going to be is going to be the definition of different stage of labor. Stage 1, the first stage of labor is when the cervix is close to 10 centimeter dilated. Is it clear? When the cervix is close, that is 0 centimeter to 10 centimeter dilated, it is stage 1. Now in the latent phase is when it is 0 to 4 centimeter dilated, while in the active phase is when it's from 4 centimeter to 10 centimeter dilated or fully dilated. 10 centimeter dilated is the same as fully dilated. Is it, and from the active phase that we open the pathogram. It is as from this level that you start opening the pathogram in order to monitor labor. If you want a picture of pathogram and an explanation of the pathogram, just ask in the comments so that we do it further. Now stage 2 is for full dilatation, that is 10 centimeter dilated, to the expulsion of the fetus, and it is as from this stage that we are going to visualize now the mechanism of labor. Basically, I'm going to speak about the mechanism of labor. Now stage 3 is going to be from the expulsion of the fetus to the delivery of the placenta. Is it clear? To the delivery of the placenta. Is it clear? So from this level now, you are going to speak now about the active phase of the second stage of labor. Is it clear? And then the stage 4 now is going to be the postpartum monitoring. Is it clear? Postpartum monitoring. Is it clear? So it is for 2 hours. When you have the 2 hours postpartum monitoring, is going to be in stage 4. We are going to speak about all of that. Now we start now. So we have already visualized in this. So we are going to start now by visualizing the management of each stage of labor and what are the things that you are supposed to do in each stage of labor. Thank you.